We'll take you live now to Victoria, where Premier Daniel Andrews is providing an update.
Thanks very much. Firstly, there are 19,479 aggregate confirmed cases of coronavirus in Victoria. That is 76 new cases since yesterday. I'm sad to say that there are now 661 Victorians who have passed away from this global pandemic. That includes 6 deaths that occurred yesterday, that is, or in the last 24 hours, and 5 deaths that occurred prior to yesterday but in recent days, and the Chief Health Officer can speak to that in just a moment. Those numbers are being reconciled as they come to us. We report them as soon as we are in a position to do so. I can go through some breakdown of those numbers. 1 male in their 60s, 1 male in their 70s, 2 males and 2 females in their 80s, 2 males and 3 females in their 90s. And again, we extend to each of their families our deepest sympathies, our condolences and our best wishes at what will be a very, very difficult time. 10 of those 11 deaths are linked to aged care outbreaks. There are 298 Victorians in hospital. 21 of those are receiving intensive care and 15 of those 21 are on a ventilator. A total of 2,372,112 test results have been received since the very beginning of the pandemic. That's an increase of 15,820 results since yesterday. There's some 4,370 cases with an unknown source, an increase of just 1 since yesterday. There are 286 healthcare workers who are active cases, and the total number of active cases across the state has now fallen to 1,956. In terms of the metro-regional split, there are now 102 active cases in regional local government areas that are under stage 3. That number continues to fall. That's very pleasing. Those numbers are low and they need to stay low. And thank you to every single person across regional Victoria who is playing their part in achieving that outcome. Colac, there are 23 active cases, 6 new. Greater Geelong, 21 active cases. Greater Bendigo, 6 active cases. Ballarat has just 2 active cases and no new cases. That is to say that those numbers show that those communities that we had significant concern about some weeks ago, when, for instance, there were more than 500 active cases across regional Victoria with a real concentration in that Geelong, Ballarat, Bendigo, those regions, those numbers have come right off and we are very pleased with that. In terms of active cases in aged care, there are some 944 active cases across aged care. Active cases in disability facility settings, 24. That's a decrease of 6 since yesterday, and the breakdown of those 24 is 12 in staff and 12 in residents. So essentially, it is good to see these numbers continue to fall. It is good to see that the strategy continues to be successful. Obviously, at 76 new cases, that is still a really significant challenge for us. And to open up with those numbers would, of course, see the total number of coronavirus infections explode. It would see many, many hundreds, indeed thousands of Victorians infected with this virus. So, as frustrating, as challenging as it is, we need to stay the course on this. That's why tomorrow we will outline a roadmap to ease these important restrictions, to ease out of the second wave once it's appropriately and properly defeated, truly defeated, so that we can be sure that the settings we lock in can be defended. That is, our coronavirus detectives have got not just a fair chance, but there is a strong likelihood that they are able to actively suppress cases, because there will be outbreaks, there will be hopefully very small numbers of additional cases in the weeks and months to come, but that's got to be a fair fight. Pretending that any contact tracing team anywhere in the world could keep numbers low when you start from a high base, particularly a high base in terms of mystery cases, that doesn't do any of us any good. I want to thank Victorians for the way in which they are following these rules, the way in which they're all making a really important contribution to a strategy that is working, and to a strategy that in its totality will give us a COVID normal that we can lock in, so that as we look to Christmas and we look to 2021, we have every confidence that we can have a stable set of rules, that we can find that COVID normal, that we can save lives and livelihoods, that we can open up and stay open. Not be open for just a few weeks, but be open for as long as it takes to see this thing off until a vaccine arrives. That is the strategy. Yesterday I made a couple of comments about how heartbreaking and how very concerning it is to have so many people in the business community, for instance, very keen to open up quickly. I understand why they want to do that. It's not just for profits, it's for their people, their staff, their future. I absolutely get that. But when you really think about it, I don't know that any business, my own experience, my family background, and the people that I speak to almost every day, no one is really advocating to open and be open for just a few weeks. And if you opened at these levels, that is exactly what would happen. It would be 5 minutes of sunshine and then a third wave that arguably will be even more devastating than the second. We just have to find a way to be as steadfast as this virus. It is stubborn. The tail of the second wave is a stubborn thing. And we are seeing these numbers come down. I'm deeply grateful and very, very proud of every single Victorian who's playing their part. Just before I throw to Brett to talk about the epidemiology of the day, I do just want to again make that really important appeal to any Victorian, regardless of your background, regardless of your circumstances, regardless of your postcode. If you have any symptoms, even the mildest symptoms, as soon as those symptoms begin, please go and get tested. It is critical to us having the most complete picture of where this virus is, how it's presenting. It gives us the best sense of what we're up against. And that means we can make much better decisions to find that lasting COVID normal that can only be found after we have a slow, steady and safe easing. That's what's got to be done here, and that's what we will announce in detail tomorrow.